Big Pharma do not want you to know this. More people are taking more medications than ever before, and that is cause for concern. Use of prescription drugs has skyrocketed since the middle of the last century. Use of over-the-counter medications has exploded just as dramatically. And more of us than ever are consuming dietary supplements, herbal remedies, and other products promoted for their health benefits. Even though scientific evidence is lacking for the safety and efficacy of some of them. How many medications do you take? Do you know what those medications are for and what their benefits and risks are? Too often, drugs fail to correct the problems they are meant to solve, and instead, they simply reduce symptoms without addressing the root causes of disease. Too often, they are seen as quick and easy fixes for conditions that would be better addressed by taking measures such as changing dietary patterns, increasing physical activity, correcting sleep disturbances, and practicing techniques to neutralize the damaging effects of stress. At the same time, drugs are powerful. Some are miraculously effective, like opium and its derivatives for pain and antibiotics for bacterial infections. The discovery of insulin saved many people with type 1 diabetes from an early death. Chemotherapy agents have cured forms of leukemia and lymphoma that had always been fatal. Antiviral drugs have turned HIV infection from a death sentence into a manageable chronic illness. No responsible physician today would reject medication as a method of treating disease and maintaining health. But many other interventions exist that do not involve drugs. Sadly, they are not taught in conventional medical schools, and that is one reason that most doctors rely on medication. One example is dietary change. As a primary treatment strategy, dietary change can be remarkably effective. Evidence for the health benefits of exercise is overwhelming. The makers of those drugs, collectively known as Big Pharma, profoundly influence physicians. They fund research, which then drives practice. In the studies, drugs are measured against placebos to determine efficacy, but almost never against lifestyle changes that may work as well or better. The information that doctors rely on when prescribing comes more often from industry sources than from objective ones. Add to all this the strong desire of the patients to be medicated. Their belief in the power of drugs is as great as their physicians. It is no wonder how we came to believe that. Medication is the only or the most effective way to treat disease. Thousands of deaths occur each year as a result of adverse drug reactions. Do not assume that over-the-counter medications are free of toxicity. They can cause serious adverse reactions on their own and can also interact with prescribed medications in ways that increase risk. In television and radio ads for pharmaceuticals, announcers have to speak comically fast to list all the warnings and dire possibilities, an easy target for parody. But there is nothing funny about experiencing a severe adverse reaction to medication. Many medical interventions and treatments and many activities we choose to engage in involve risk. The key is to maintain the balance between risk and benefit. Let's not forget that drug therapy can be life-saving in cases of critical and acute illness, and is an important component of treatment of chronic illness. In the context of comprehensive care that also includes lifestyle modification and non-drug therapies. Long-term use of medications as standalone treatment, though, is simply not wise.